Good afternoon. Today we will discuss about bone sternum. The sternum or breastbone is a flat bone located at the anterior aspect of the thorax. It lies in the midline of the chest and it has a T shape. As part of the bony thoracic wall, the sternum helps and protects the internal thoracic viscera such as heart, lungs, and esophagus. In this video, we shall look at the osteology of the sternum, articulations, and the clinical correlations. Usually, the sternum contains three parts: manubrum, body, and xiphoid process. In children, these elements are joined by a cartilage. The cartilage ossifies to bone during adulthood. So, let's discuss about manubrum of the sternum. So the manubrum is the most superior portion of the sternum. It is trapezoid in shape. The superior aspect of the manubrum is concave, producing a depression known as jugular notch. So this is the jugular notch. You can see this is the jugular notch. The superior aspect of the manubrum is concave, producing a depression known as jugular notch. This is visible underneath the skin. Either side of the jugular notch, there is a large fossa lined with the cartilage. These fossa articulates with the medial end of the clavicles, forming sternoclavicular joints. You can see this is the articular site for the clavicle, and here the clavicle is attached to the manubrum of the sternum. Okay, the junction between or joint between the clavicle and sternum is known as sternoclavicular joint. So this is the in this picture this is the sternoclavicular joint. On the lateral edges of the manubrum there is a facet for articulation of the costal first rib. So this is the costal first rib and a articulation with part of the cotal cartilage of the second rib. So this is the where first rib attaches to the sternum. And inferiorly manubrum articulates with the body of the sternum. You can see in the picture inferiorly the manubrum is attaching with the body of the sternum, forming the sternal angle. This is the sternal angle. Okay, the joint between the manubrum of the sternum and body of the sternum, this is called sternal angle. This can be felt as a transverse ridge of the bone on the anterior aspect of the sternum. The sternal angle is commonly used as an aid to count ribs, as it marks the level of second costal cartilage. So this sternal angle is useful for the clinical to count the ribs for the surface anatomy. So let's discuss about body of the sternum. So this is the body. The body is flat and elongated. The largest part of the sternum. It is articulates with the manubrum superiorly. So manubrum of the sternum superiorly and xiphoid process inferiorly. Okay. The lateral edges of the body are marked by numerous articular facets. These articular facets articulate with the costal cartilages of the ribs 3 to 6. These are smaller facets for articulation with parts of the second and seventh ribs. So let's discuss about the xiphoid process of the sternum. Xiphoid process is the most inferior and smallest part of the sternum. It is variable in shape and size with its tip located. See, you can see this is the xiphoid process. The tip located at the level of the T10 vertebrae. So it is located exactly to the T10 vertebrae. The xiphoid process is largely cartilaginous in structure and complete ossification takes in later in life. around the age of 40. Until 40, this is a cartilage. After 40, this ossification starts. In some individuals, the ossified process articulates with the part of the costal cartilage of the seventh rib. So that is not so clinically so important. So these are some pictures of sternum. And let's see what is the clinical importance. Clinical relevance of the. So first we will discuss about the clinical relevance of the sternum. So sternal fractures are associated with severe blunt trauma to the chest, such as in the vehicular accidents. They are relatively uncommon. So the fracture or the breakage of sternal is very uncommon. It needs severe blunt injury or trauma to the chest. And second, another clinical anatomy, typically the sternum will break into several pieces. This type of fracture is classified as a comminuted, comminuted fracture. The most common site of fracture is the manubrosternal joint, where the manubrum meets the body of the sternum. Despite the degree of damage to the sternum, the fragments are not usually displaced due to attachment of the pectoralis muscles. And another important clinical anatomy is sternal fractures have a high mortality rate, that is 25 to 45%. This is not due to fracture itself, but usually the result of heart and lung injuries, which are likely to occur simultaneously with primary trauma. Because of this, it is crucial to check the patients with sternal fracture for visceral injury. X-ray, CT, and ultrasound are common investigations. Thank you.